My name is Elizabeth Henry. I'm the Director of Policy and Advocacy with Recovery People, and I'm also a woman in long-term recovery. And welcome to our first Brown Bag Advocacy series of 2024. We made it through 2023. It got a little hairy in some places, but I'm really glad we're all here today, and I thank you all for joining us. And just a couple of housekeeping things. First of all, I want to say how excited I am that we have our presenters here today. They are so very knowledgeable of all things Opioid Abatement Council and are really doing a lot of hard work. And I'm grateful that they have joined us today for this session. Please make sure to stay on mute. If you have any questions throughout the presentation, please feel free to use the raise your hand feature or put them in the chat. We do have folks that are monitoring the chat, and we will try to get to those as best we can throughout the presentation. Also, if you would please do us a favor, at the end of the presentation, we will put a link to a satisfaction survey in the chat. We would love to have your feedback on how we did and what we can do going further to make sure that we provide the best education and information to our community and to our stakeholders. Also, that same survey will get you 1 hour of a TCB approved CE. So if you need continuing education credits, please make sure that you fill out that survey. But again, even if you don't, please fill out the survey. We would appreciate it. So to kick us off really quick, I'm going to launch 2 questions to see kind of just who's in the room and how much information we know about the Opioid Abatement Council. So here is the first question. So the first question is, what best describes you or your organization's work? So please make sure to, this is anonymous, we won't know who's clicking what, but please make sure to fill it out. We'll leave it up for about another 15-20 seconds. We got about 50% of people have responded so far.
What is SAD treatment again?
Substance use disorder.
Oh, thank you.
Sure.
I'm not me. Okay.
And we do have an other option. Otherwise, we would have ended up with a list 25, 30 options long. So if yours is not listed, please make sure to put it in the chat. We would love to know what we did not add onto our poll. All right, so just a couple more seconds. All right, let's see what we have here. So here are our results. We've got about 52% of the folks here work in substance use disorder peer support, about 29% in recovery housing, 35% in harm reduction. That's fantastic. We've got 38% prevention. We do have 13% not listed. So if you would please put your not listed in the chat, we would love to know what we might have missed on this. Advocacy, state agency. All right, and here is our next one. Here we go. All right, next question. This is the last one, I promise. Have you heard of the Opioid Abatement Council and the work that they do? Give this one just about 20 more seconds. All right, this one looks pretty well split, about a third for each one. Some have not, and some have heard of the council but aren't real sure what they do. So that is very valuable information, and we really appreciate you taking the time to let us know that. All right, so let's introduce our speakers, because that's really why we're all here today. First of all, Dr. Holleran-Steiker, would you like to introduce yourself, please?
Sure. Good morning, everyone. My name is Lori Holleran-Steiker, and I am the Steve Hicks Professor of Addictions, Recovery, and Substance Abuse Services at the Steve Hicks School of Social Work at the University of Texas. I'm also the Associate Dean for Student Engagement, Student Success, and Wellness for undergraduate college, and I am involved in a variety of opioid response projects, and I am just delighted to be here to share what we're doing with the council.
Excellent. Thank you so much. So glad you're here. Amanda.
Yes, thank you so much for having me today. I am Amanda Lopez, the director of the Texas Opioid Abatement Fund Council program here at the Controller's Office. And I appreciate the opportunity to share, and especially this question. It's going to help me understand the pace of today and hopefully also allow for continued opportunity to learn more about the council. And so with that, I also want to introduce Nar Doricott. She's on today, and she is our newest addition here at the program as our communications and community relations specialist. So my hope is that today is the beginning of a relationship, not just with recovery people, it's been an ongoing relationship, but with all of you. So thank you so much for having me.
Excellent. Thank you. We're glad y'all are both here. Dr. Thornton.
Hello, good afternoon, everybody. My name is Doug Thornton. I'm an associate professor at the University of Houston College of Pharmacy. I work in the Department of Pharmaceutical Health Outcomes and Policy, as well as the director of the Prescription Drug Misuse Education and Research, otherwise known as the Premier Center. I'm also the representative for Region 3 on the Abatement Fund Council, which is the Harris County, and then the greatest Harris County area covers about 13 counties. A pharmacist by training, and my graduate work was in health services and outcomes research. So what that is really talking about how to more efficiently deliver healthcare services. And so I'm very thankful to have the opportunity to do that in this space and contribute my energy to the Abatement Fund Council. So great to be here today.
Excellent. Thank you. Great to have you. So without further ado, I will turn things over to Amanda Lopez, and she will get us going.
Great. Thank you again, Elizabeth. Okay, so the first couple of slides are meant to make space for just a general, how did the council come to be? So back in 2021, the Texas legislature decided to create a new funding structure for the receipt of these funds that were going to be coming in as the result of settlements between the state, local governments, and the opioid manufacturers and distributors. So in the 87th legislative regular session, we got Senate Bill 1827. I make a note of this in a bullet because if this legislature had not acted, these funds would have just flown all to the legislature to decide how to use, along with all of the other revenue that the state receives. So it was significant that the legislature looked at that point in time. Some of the major litigation had not been settled, and so they were looking to create something for the future when these funds were coming through, are going to be received. And so in doing so, in creating this new structure with this governing body and a new flow of funds, the legislature looked to documents that were part of that process, the litigation and settlement process. And so I highlight some of those here for you as they're helpful. Again, they were helpful to the legislature, and they've been helpful to us in developing key components of the council's work. So for example, in the Texas term sheet, this is a document where the local governments, along with the Texas Attorney General's office, collaborated to figure out their minimum settlement standards, what they wanted to see, at least when it came to negotiating certain terms, distribution to local governments, for example, specific uses of the funds, and even the concept of creating a governing body like the council. You see those first elements in the Texas term sheet. And then the Texas Global Settlement Agreement, that is a settlement agreement that then started to incorporate what the defendants, the manufacturers, the distributors also were willing to then concede. So it's kind of incorporating the term sheet and then the other parties. And then finally, the list of allowable uses of opioid abatement funds. Again, all the parties collaborated to figure out a non-exhaustive list of eligible uses of the funds, wide range within this large list. And so there we kind of get the lay of the land for what guided the creation of the council to help figure out where the council wants to go in the future. And so now we'll get into the council. They are 14 members. And here's the breakdown. It's comprised of appointments. So we have 3 from the Office of the Governor, 3 from the Texas, or 2 from the Texas Attorney General, 1 from the Lieutenant Governor, 1 from the Speaker of the Texas House of Representatives, and then 6 from the Health and Human Services Commission. And actually, as Doug mentioned, those 6 then are provided by regional appointment kind of nomination process. So Health and Human Services Commission had to look to their regions to receive names before then making that appointment to the council. And then the controller sits as that 14th member in a non-voting capacity, but does preside over the meetings. And thus then we, Nara and I, are the administrative support to the council. Okay. And now I'm going to walk through in words, first the funding structure, and then I have an infographic. And that infographic is also available on our website. So here I just want to give some context. So like I said before, it's a new to government way to see these funds flow. And there's different decision makers through the process. So it's not just the council, it's not just the legislature, and it's not just local government deciding how to utilize these funds to make change in the opioid crisis. So 15% is going to the legislature of what the state receives. And that's going to an account called the Opioid Abatement Account. And the legislature in law put eligible uses to help guide the legislature when it comes to making those difficult appropriation decisions when they come and meet every other year in odd numbered years here in Austin at the Capitol. And then a bulk of the funds don't go through that process, right? You see about 85% are going to a special trust fund. And this is a newly created trust fund, the Opioid Abatement Trust Fund, and it's held by another state entity, the Texas Treasury Safekeeping Trust Company. And they're like a sister organization to the Texas Controller's Office because the controller sits as chairman of the Texas Treasury Safekeeping Trust Company. So it's still being held by the state, but it allows for the distribution of those funds to then flow through statute instead of having to wait for that appropriation process to happen, which, like I said, only happens every other year. And then within that 85% about breakdown, it trickles through different entities. So the law provided a single one-time distribution of $5 million to the Texas Access to Justice Foundation for supporting civil legal services to those that have been affected by the opioid crisis. Another distribution goes to cities and counties, municipalities and counties, a direct distribution to those local governments to, again, abate the opioid crisis in their communities, but allowing those cities and counties to decide exactly how to do that in their communities. And then a hospital district allocation, similar to the cities and counties in the sense that they are going to be receiving these funds, not through a grant process, but through a demonstration that they've met the logistical needs that the law and that the council is asking of them. But actually, what I want to stop for a moment here is the way exactly the hospital districts are going to be receiving their funding is out for proposal now. The council recently made a decision in November for a formula about how to see the distribution to these hospital districts in a tailored approach, acknowledging that not every hospital district is the same size, same service area, same participation in the litigation. And so I encourage you all to look at the Texas Register or again, connect with us after for a more direct link to where to find those proposed rules as the period for providing us a comment is closing at the end of the month. But I'll come back to the formula. So, and then the Controller's Office takes an administrative fee, and then finally we get to what the council has a say over. And on an annual basis, that has a regional distribution to ensure all of Texas is being served, and then a targeted approach allowing the council more discretion on targeting and focusing those funds. So again, this is in words, and now we're going to see it in a picture. So here is an example. This example is grabbing an estimated all in after 18 years of payments have been received. The state of Texas is expecting $1.6 billion. And I say all of that with all that context because all of these settlement agreements are on different payment schedules and different payment amounts within those payment schedules. So it's not a consistent equal amount each year from each settlement agreement, the longest one being an 18-year payment period with certain balloon payments and then reduced payment amounts and then another balloon payment. So after thinking through which ones were final, meaning that we as in staff had received a settlement agreement signed by all the parties and the judge presiding over that process, we took those estimates and made this 1.6. Now we understand there's more work going on in this space with the Texas Attorney General and with the local governments. And so this could be significantly more in out years because litigation will continue to happen, settlement agreements will continue to happen. So this is just to give the example of how the funds would actually flow. So again, I walked through that 15% and the 85%. So you see that split happening in maroon. So that's the about 244.7 million all in will be for the legislature to decide, and then the remaining being in the trust fund. And then here you see how that Texas Access to Justice Foundation is being captured visually, the cities and counties distribution. And then we're going to drop down to the red, and you see again that sliver for the administrative costs. The hospital districts getting about 15% of what's available for the council to distribute. And then you see the remainder, again, an all-in number of close to $1 billion as what the council is going to oversee over this at least 18-year period. Okay. All right. So I hope it was helpful to have both a visual and for me to talk through and this example of funds. So then the role of the council. So as you saw in that infographic, right, it's down to that gold level of where the bulk of the council's work is going to come next. And so these are grabbing text just from the statute. So we know from the law that the goal is to allocate these funds fairly and to spend them to remediate the opioid crisis in the state by using efficient and cost-effective methods. Okay. And directing them to regions of the state experiencing opioid-related harms. So we know our goal, and then we get some direction on how to go about doing it. So we know the council has to select funding priorities, and they have to be based in evidence. So the statute does use that evidence-based term, but doesn't define it. And then we know that, like I mentioned before in the funding structure, that there has to be certain metrics met between the regional and the targeted allocations. And then again, statute does guide the council to develop an application and an award process for the funds that they are going to be overseeing and distributing. And part of that process of putting the text of the law into work was by adopting their own processes, right? But beyond just those high level tasks, the council chose to provide a bit more detail in the Opioid Abatement Fund Council rules. They passed those last June. And so this gives an overview of the general life cycle of a grant. So from what to kind of expect in, for example, a notice of funding availability, what to expect in the application, what to kind of expect in the criteria. What to expect in how it would move. So for example, an application would be received, go through an administrative review, go through a secondary / peer review concept to be graded without any requirement to follow that grading, because then ultimately the decision lays with the council. And so again, we have this summary available on our website so that one could get that high level overview of the rules before diving deep into the way they're written on the Texas Register. And that's the official site for them on the side. Okay, and like I said, one of the things that has been established in law is that the council must adopt at least a strategy. The strategies must be evidence-based. And to start that process, the council looked to the eligible uses outlined in the settlement agreements. Again, it's a non-exhaustive list, most commonly known as Exhibit E in the settlement agreements. That's typically where it lives in all of them that have been finalized thus far. And then within the rules, the council restructured all of these potential strategies into categories to try to make it have a little bit more meaning aside from how it's outlined in the settlement agreements. And in trying to even break down their work even more, right? The council being a large 14-member group, the council also looked to each other as resources and established working groups. And so the categories and strategies working group helped that organization of the strategies into more manageable bites. And then the short-term strategies and research working group did their part to look at the same list, but look for opportunities that could be executed more quickly. And so I'll pause there as I call her Lori. I appreciate her. And I called them Doug because, again, I value so much how much they've contributed and allowed me to work with them in this process. So I'm going to open it up and have them chime in about their experience on the working groups.
Fantastic. Thank you so much, Amanda. And we really couldn't be doing this work without Amanda and her team. They are extraordinary. They are working nonstop, getting all the background information that we need, working on with the lawyers on the wording of things. And we were really excited to get those rules into place so that we can start designating which the prioritized funding mechanisms would be. We are calling this short-term strategies because we know that the council's been in existence for a while and we wanted to hit the ground running with some potent areas. And so in our work group, we have a variety of disciplines. Of course, I'm a social worker and I have done some studying of the hub and spoke model and the community-based ecosystem that expands that beyond the hospital system into the community with an awareness that where the rubber hits the road very often is with our folks with lived experience. I see a lot of you are here today, so I want to speak to that and celebrate that. I was trained as a peer recovery support specialist when the trainings first started at Communities for Recovery. I am a person in long-term recovery. And but we each bring something different to the council that allows it to have layers of perspective, and all of us are staying abreast of the literature. And that's another thing that Amanda's team has done a great job of compiling so that we're on top of it with the most recent and cutting edge research at any given time. But you will see on this particular slide that the decision has been made, and these were approved by the entire council, that the first 3 grant series of grants that will go out for RFPs was naloxone distribution and treatment and coordination of care category, K-12 substance abuse prevention awareness in the prevention and substance and public safety category, and to enhance peer-to-peer workforce. We are aware that 1, that there's not enough folks doing the work. 2, that the folks that are doing the work don't necessarily have the support that they need and the resources that they need. And 3, we'd love to see that expanded statewide rather than just be in pockets where the RCOs exist. So, so all of these things emerged in the midst of our prioritization as areas for us to dive into. And the way that this would work, and I think we'll talk about it in a general way, we're still working on the proposal application. But the way that it would work is that there would be entities that would receive the grants that would disseminate through other organizations and agencies. And maybe Amanda will say a little bit more about that afterwards. But we are excited to get this going. I want you to know that while the council is a very nose to the grindstone place, many of you that know me know that it's a very emotional space as well. We have lost so many of our colleagues and friends that making these decisions, I have to say, is driven by the spirits of those we've lost and the spirits that we can protect as we move forward. So I am so grateful to be part of this process and to watch it moving forward in such a well-orchestrated way. So that's, I think, what I got to introduce those things. Doug?
Yeah, thank you. Again, to take one small step backward, I think it's important to note that we are trying to identify where we are within the state and within the nation in terms of funding opportunities. And that's always been something we've come back to is, well, if we were the only group providing any funding for anything, we would approach this a lot differently. What we are, and as Amanda showed, this has an 18-year time horizon. And so in some ways, we're being deliberate because that's the plan. There needs to be a long, an entity within the state really focused on what a long-term time horizon would look like and setting up the infrastructure needed to carry those things out. And so some of the questions that we've had in the past have been about, well, the grant submission process, the peer review process, what those things look like. And one of the, I think, benefits of the Opioid Abatement Council in Texas is that we have had the opportunity to build those infrastructure points. I've had the opportunity to speak in a few national forums about abatement council, so I've had gotten the opportunity to look at what other states are doing. And Texas gets bashed for a lot of things, but I really do feel that the way the legislature and the way the state and the stakeholders have come together to build the abatement council is in a lot of ways progressive and unique in that they've taken a lot of the responsibility and put it in the hands of professionals. And we have, working with Amanda's group and working with my colleagues on the council, have really tried to receive input from as many points as possible. I don't know, Amanda, if you'll talk about it, but we've had 2 different sets of surveys go out to different stakeholder groups and really be able to collect the perspectives of the people within the communities doing the work. And so one of the groups that I was on that was mentioned on the slide is the Categories and Strategies Working Group. And so it's taking what the legal entities were able to identify as what they call their core strategies. And there's a couple examples here in this on this screen clip, and really bucket those into strategies can be turned into funding opportunities. And so one of the things that I feel like I bring to the council is I've served on grant review panels for multiple federal agencies for quite a few years now, and building something like that from scratch is not a trivial matter, because we want to make sure that it is able to be accessed by every region. That's one of I try to bring it up in our work groups as much as possible. One of the metrics I want to see us hit is, do we get high quality applications from every region? And we want to make sure it's not just the big cities that have the universities or the big, substance use institutions in them able to submit grants. This is it's for them, but it's also for all the other regions without that infrastructure. And so I'll leave it at that for now. And if there's anything else, any other questions or concerns, but that's really where we've been focusing. So.
Yes, thank you so much, Lori and Doug. And they're not giving themselves enough credit, as the work that came out of the categories and strategies not only helped bring more meaning and make more sense to the populations that are going to be participating in this grants, but then to Doug's point, helped us facilitate a public survey that took, again, that same organization structure and that same language that was more accessible, and have the community tell the council, at this point in time, that temperature check of where priorities existed within each category, and then holistically. So that was, again, adding to the information, as well as Lori mentioned, that the council members all come with their own backgrounds and their own experience across disciplines, from law enforcement to hospital district administration to mental health and the medical care system. So greatly appreciate that the council is comprised with that much diversity, as well as the legislature had that foresight to put it in law that they have that requirement. And then coming together in the short-term strategies and research group, looking through this list and figuring out, based on their experience, where could they land on something that was more attainable, and then also still meeting that need. And so appreciate that they worked through all different kinds of options, all different kinds of ways to figure out where to start. And then also listening to us administratively, what could we start to execute quickly based on the capacity that exists right now at the controller's office, and where we needed to start to build capacity to continue to meet the needs and goals that the council members have. So we started here, but I say that very big emphasis. We're starting here, and with optimism. We're going to go somewhere else. We're going to go as we continue to learn about not just needs, but also capacities, but also what changes at the legislature. Again, to Doug's point, where the legislature chooses to open more doors and provide more funding opportunities across the state and at the federal level. We're trying our best to collaborate, not just with within the infrastructure that the councils provide, but also within state government. As one of the council meetings that they held back in October of 22 was to acknowledge the bringing together of all the different state agencies having a space to make change in the opioid abatement services. So as Lori already outlined, the strategies had to be picked first, and then some detail came to what that would look like. And that was in adopting a grant plan for 2024. And so that's putting those strategies on a cycle, so to speak, of when each grant opportunity is going to be made available. So the goal for this first grant opportunities the naloxone distribution, and we're doing our best to make the information available this spring. And here you have what at a high level, again, to make space to continue to think through the details, to continue to think through what are the questions we need to make sure we're answering. But this is enough guidance to start that conversation, and to provide the opportunity for CPA staff to continue to work with council members to figure out those details, those very important details, to make sure that these grant opportunities are successful. And so highlighting some of the examples of how these, what these grant opportunities would be funding. So in the naloxone distribution, you see that it's a grant opportunity for up to $25 million that may be used for the distribution and administration of naloxone. And the eligible applicants would be statewide providers with the opportunity for subcontractors or subrecipients. And again, the how and all of that will work is getting fine-tuned in language, and it will be coming soon. And our hope is that in the notice of funding availability, again, that document that was created by the council's rules, that will be the place where a lot of these questions will be answered. And if there's not, then there's going to be space for questions on staff to answer about what's missing from the notice of funding availability, or questions about the application. All of those things will be built into this process to hopefully provide the resources for someone to at least successfully complete an application. So that's generally, regardless of it being naloxone or K through 12 abuse prevention and awareness, or the peer-to-peer workforce enhancement. All of the grant opportunities will have those basic elements of a period to absorb, a period to ask questions, a period to receive those answers, and then a period to ensure a complete application. So then I'll move to the K through 12 substance abuse and prevention awareness, again, similarly up to $25 million. And for the grant opportunity to promote K through 12 substance abuse prevention and awareness. And then the last one just didn't fit on the same slide, but aiming for, oh, apologize, want to go back. This one is hopeful to be on the tail end of the naloxone distribution. If not, then around summer of this year is when we're hoping to make that opportunity and the materials associated with it available. And then last is the enhanced peer-to-peer workforce for this fall. And the grant funds there outlining that they may be used to provide enhancements, including training, continuing education, certification assistance, merit pay, subawards, and reporting on positions for recruitment and retention. So this is what we had, we know now. This is what we know. This is what the council voted on for staff to continue to build. And I want to revisit the working group concept to provide a little bit more clarity. So the working groups are a subset of the larger council members. So as capacity allowed, as interest allowed, some council members again raised their hand to take an additional role, additional step, additional service to this effort to provide staff that necessary expertise in drafting that. And I can't thank enough for both Doug and Lori raising their hands to be part of that. So that we can ensure that we are not only meeting the needs of the communities, but also making sure we're doing this within the lines of best practices, because we do get to draw the roadmap to some extent. And so we want to make sure that we're doing that in alignment with best practices and what is also going to be most effective. So
Can I also add one more
yes,
thing?
I was going to say, please, now,
yeah,
Doug and Lori.
Oh, fantastic. One of the things that I really appreciate about the process is we've been trying to design these things so that they're not so narrow that they can't include more innovative practices and things that all of you are encountering as potential directions. So for example, K-12 substance abuse prevention isn't us distributing a list of programs and somebody saying we'll implement them. It really can include PTA and parents and communities around these issues. So it's we're trying, as specific as the calls will be, there's sort of a wide net in terms of the types of things that you guys know work in the community that would be considered in the review process.
And then Doug, would you like to add anything about kind of how this is, the development of these documents is going?
Well, yeah, sure. Yeah, I'm on the group that is helping create the specific language. And I think what we've agreed to for these, what we call short-term strategies, keep things as standard as possible so that we're not trying to customize a lot of things. But as we move into because again, you can see these as three big buckets.
Mm-hmm.
These are three big buckets that potentially you may think, well, this isn't exactly what I do, and that is a nature of the beast, so to speak. The next big phase, and we haven't talked a ton about it, is what the non-short-term strategies look like. And that's where we're trying to write and make sure that these notice of funding opportunities are written in such a way that, one, you feel comfortable knowing, yes, this is the call for me. And two, yes, I feel confident being able to write a grant that responds to these pieces of information. And so I've been on both sides of that equation for sure, as the person who's writing a grant, and then it's like, well, I'm not really sure if this is exactly what they want. And that's a terrible feeling, because you feel like maybe you're wasting your time or it's going to be fruitless. And we really are working to try to minimize that feeling among the applicants as much as possible. So some of that means we need to, make sure the language is written in a way that somebody that doesn't work in the comptroller's office, no offense, could understand it, and feel comfortable being able to write towards it. And so, yeah, we're working on customizing all of those in the background as well.
I also would love to challenge those of you that are thinking about these grants to really think about those that you collaborate with, because I think the best possible serendipitous outcome of this process would be a growing of this web of responses as opposed to siloed initiatives, which so many of us know that with fewer resources, we wind up competing against each other, as opposed to now that these resources are going to be available, it's an opportunity to build those. It's one of the reasons I really appreciate agencies such as Recovery People, which really are connecting tissue essentially to bring agencies together. So we hope you'll stay tuned and continue to be bold in terms of reaching out to each other.
Yes, and thank you for that term, because stay connected to us. And as another plug that Doug mentioned, so this is again where the council is starting. It's starting in what can we execute quickly in terms of funds in a meaningful way, while also testing our systems like Doug described that will allow for that notice of funding availability and the receiving of applications to create that basic infrastructure that CPA can manage, and then we can continue to build in with more robust and other funding opportunities that come. And so the ways to keep up with, where is the council going to go next? Please, if you can, sign up for our email listserv, as well as be mindful that these grant opportunities will be posted not just on the website, but also on this website, the eGrants website. And then right now that is live, if those of y'all are curious about just generally potentially wanting to access council funds, we have an intent to apply form that is a way for us, not required, just to know about the great work that you're doing, high level, who's the point of contact, what's going on in your space, what are your goals, and if you are considering funding or applying for funding in the future, under what category would you consider yourself participating in? And then the service area. Are you an entity that can provide services statewide? If it's regional, we allow for a drop-down list of serving based on county. So please, if you can, that helps us better learn the lay of the land across Texas. And then, like I said before, and as the council members have mentioned, we do want to make sure that adequate information is available once these grant opportunities are live. So educational materials, hopefully answering all of the very valid questions that y'all pose to Recovery People are there. And if they're not, then please hold us accountable and ask them during that question period. And that is all I have formally. And I think that gives us about 15 minutes then for questions.
It does. We did have a couple of questions in the chat. Really quick before we get to those, I did want to say to everyone in the room, if you have not filled out the intent to apply form, it's very simple. It's very straightforward. You do not have to fill out a grant narrative in order to fill out this form. It is very short, sweet, and to the point. And as always, especially our service providers and stakeholders, we are here as resources. And our agencies and our friends at the council really depend on that. So please take those few minutes and fill that out if you've not done that yet. So a couple of questions in the chat. One of them is, does the OAFC have any expectation regarding the number of grants within the $25 million allocation that they anticipate awarding within each short-term strategy?
Great question. And that answer will be coming soon. So I'll go back to what we have here. So you see consistently that the goal is to find a statewide provider. And then to Lori's point, where the innovation is about providing those services is where we're exploring how to create that. So know that the criteria and then also the rubric for which an application will be quote judged or evaluated will be outlined there. So it'll be up to the individual to interpret the application, how they best can propose something that meets the needs, and then what that then would look like in terms of number of grants. And then also distinguishing the fact that an entity may receive the funds, in the example of naloxone distribution, purchase the naloxone, and then the end beneficiary being the actual recipient of the product, not necessarily the funds to buy more product, right? That's hoping to be able to move the product and the training associated with naloxone.
All right, next question. Will the grant include more recent opioid reversal medications targeting fentanyl, like Opvi?
Right now it's naloxone. So again, that's the right now where we're getting started. So that's a great point. Appreciate, understanding that we have, there was, again, I appreciate that the short-term strategy working group really did think through all the different ways to be able to do this. So opening up what kinds of moods, right? Medications for opioid use disorder. And here we're testing naloxone first.
Excellent. And could you clarify a little bit what you mean by a statewide provider?
Yes, thank you for that. So again, that answer is coming soon, more formally, but this is where we're again balancing that innovation with also meeting our administrative needs. As the staffing here at the controller's office is still in a little bit of an unknown space to be able to meet the needs. So to your point, Elizabeth, I appreciate that you made an extra plug for that intent to apply form, because that's going to help us know how we need to grow. If we can see what types of services are going to be provided across Texas and by who and what kind of eligible applicants and the volume of applicants in a specific category or in a specific strategy, then we can know the human power that we're going to need to be able to facilitate reviewing these applications and then also how these grant opportunities are going to actually make meaningful change. So it's a long way to say that statewide provider is meant to acknowledge that the preference being an entity that can provide these services statewide. Again, but allowing for the creativity of how, and again, that's in actually the rules that the council outlined, that I don't want to say criteria or a metric, but it acknowledges that how one is going to meet the geographic needs, how one is going to interact with their colleagues or the other entities that are working in a similar space. That's going to be an element that is looked at in the proposal. So what is statewide provider? Again, that answer is coming soon, but right now it's acknowledging that we need an entity that can be held accountable for the execution of this grant opportunity.
So as far as needing to be a 501c3 nonprofit or anything like that, that'll be worked out in what you guys are working with right now.
Yes. And the rules do require at minimum being at least registered with their Secretary of State's office and entity doing business in Texas.
That is a good point. They do need to be registered as an entity in Texas. Do we have any other questions from our participants? Feel free to use the raise your hand feature or put them in the chat. No? All right. Well, Chelsea has put the link to our satisfaction survey in the chat. Even if you do not want CEs, please, please, please fill out this survey. It would really help us a lot. If you do want CEs, you have to fill out this survey or you won't get one. But again, I really thank everyone for their time today. And thank you, Chelsea Collier. She is our Prosper Project Coordinator here at Recovery People, and I have just loved getting to work with her. And we appreciate Amanda and Lori and Doug, everyone for being here and sharing this information with us. And Should you need anything from us, please feel free to reach out. We are a strong community here and we are always here to support you guys however best that we can.